Washington, our focus, the Biden administration marking a milestone decision on COVID-19. It will end the U.S. federal pandemic emergency declarations. The measures will start winding down now, and they will formally conclude on May the 11th. Let's bring in Magda Gabrisalassi, who's in Washington. That U.S. move, Magda, or the one that we're hearing about just hours after the World Health Organization yesterday announced it would keep its designation of COVID-19 as a public health emergency of international concern. What will the Biden administration decision to move away from that, what will that then mean?
Well, this means that there are two orders that will be coming to an end. So the COVID-19 national emergency order, and as well the public health emergency order. So these two declarations, they've been in place since early 2020. They've been renewed every 90 days since then. And what it's meant is ongoing funding so people can have access to free vaccines, COVID tests, and treatments. But when these orders come to an end, well, some of that's going to be booted over to private insurance companies as well as federal or state health coverage programs. So that's going to mean some out-of-pocket purchases for people that are looking for at-home tests and treatment as well. Some of the people will have to pay for that. Vaccines, however, will continue to be free. So the White House says it's announcing this now, essentially to give people time to adjust. And here is part of the statement. An abrupt end to the emergency declarations would create wide-ranging chaos and uncertainty throughout the healthcare system for states, for hospitals, and doctors' offices, and most importantly, for tens of millions of Americans. So that's the reason the administration is giving for announcing this now. Here is what Dr. Isaac Bogosh thinks why the U.S. is making this call now.
That might be tied to actual dollars that fund programs for testing or treatment or disease surveillance activities in many places. So that might actually be rather consequential from how the U.S. manages COVID-19.
Now, this decision is being made even as COVID continues to kill an average of more than 500 people here in the U.S. a day. And of course, as you said, it was just yesterday that the WHO announced that COVID-19 is still a global health emergency, but it seems that the U.S. is ready to move forward. And there is another big change as well. The White House says that when these orders end, so will Title 42, which allowed for migrants to be removed, even those seeking asylum. U.S. officials previously, when they put this in order, said it was to control the spread of COVID. Heather.
Thank you so much, Magda. Magda Gabrisalassi, she's in Washington.